It's a pleasure to be here again on our Gousse Urology show, the Gousse Urology Health Show, to discuss several problems in urology. My name is Dr. Angelo Gousse, and I'm a board-certified urologist, a professor of urology. And this show is about trying to give you information that you might find useful on how best to take care of yourself, particularly with urologic disorders. Today we're going to talk about prostate disorders, disorders of the prostate that may affect you and may affect not only your well-being, but also the way you urinate. And many men are affected by that. Prostate conditions can be either benign, or they can be cancerous, or they can have other effects in the human body. So it's very important for you to differentiate between benign diseases of the prostate versus diseases that can cause cancer. And the diagnosis is completely different, and we'll talk about what is the best way to differentiate them. Let's first try to explain exactly what is a prostate. The prostate, only men have a prostate, and the prostate is an outlet to the urinary bladder. This is the urinary bladder right here, and this is the prostate. Many men, as they get older, the prostate increases in size, and the fact that the prostate increases in size, the bladder is unable to evacuate the urine the way it usually does, and it creates a situation of many different symptoms. Symptoms that are very typical of prostate disease, for instance, are frequent urination at night. Many men might find that during the night they have to wake up several times to urinate, and it really affects their sleep. And because of that, when they wake up in the morning, they're a little tired. Other men, what they have is that they have frequent urination, during the day, or when they urinate, they have to strain to void. They have to push to void. And when the urine comes out, the urine comes very slow. These are kind of what we call obstructive symptoms, meaning it's like a blockage. And the reason is the prostate is kind of blocking the bladder. It's creating some type of obstruction. And remember, we talk about the frequent urination, and we talk about another symptom is the men has a strong urge to urinate. They have to rush to go to the bathroom. If not, they fear that they're going to urinate on themselves and they're going to wet themselves. Unfortunately, these type of problems sometimes can progress to the point where even if you feel the urge to urinate, you make your best effort to reach the bathroom, actually urine comes out. And that's called urge incontinence. When you urinate a lot at night, it's called nocturia. And all these symptoms, they bother you. And it doesn't necessarily mean it is cancer. Usually it's the benign portion of the prostate that causes these symptoms because of enlargement. The fact that the prostate is enlarged does not necessarily mean that eventually it will develop cancer. It's two separate problems in one organ, the benign problem and potentially the cancerous problem, if you see what I'm saying. Unfortunately, in some men, sometimes they cannot urinate at all. So the urine will not come out. And that's a big problem, because then when the urine does not come out, then the bladder becomes full, it becomes distended, and none of the urine will come out. So what do you do if you can't urinate at all? Obviously, it is extremely painful when you cannot urinate at all, and then no urine will come out. That's a big problem. Often you have to go to the emergency room if you cannot urinate at all. And one of the things that is done in the emergency room is a placement of a catheter. Many of you have heard or might even be familiar with a catheter, often called a Foley catheter. The reason it's a Foley catheter is because one can inflate a balloon inside of the bladder once the catheter is inserted. Now, the catheter has a little hole in it, and that hole siphons the urine from your bladder out into a bag, which I will show you. So what happens is, once they go through the penis and the catheter is inserted, it's inserted through the prostate inside of the urinary bladder. Once the catheter is inside of the urinary bladder, it is possible to inflate the balloon. Now you will see that the catheter is inside of the urinary bladder, so the urine will start coming out, and we will drain the urine into a cup or some type of receptacle and get the urine out of your bladder, and you will start feeling better at that time. But in order for the catheter to stay in place, you got to inflate. There's a balloon, I don't know if you can see that, the balloon inflating like that inside of the bladder. That's why they call it a Foley catheter. That's the name of the doctor who discovered it. It goes through the prostate, inside of the bladder, and now the catheter cannot come out because the balloon that is inflated will not allow the catheter to come out. So it will stay in the bladder for as long as the urologist or the doctor, the healthcare provider, wants the catheter inside the bladder. Because of the balloon that is there, it will not come out. So the urine will come out all the time, but when it's time for the catheter to be removed, it is possible to deflate the balloon. This is how Foley catheter works. So now the balloon is deflated, and then the catheter comes out of the body, and then hopefully you'll be able to urinate. Now there are medications which allow a man to urinate better if they have prostate problems, blockage of the prostate, obstruction of the prostate. These typical medications fall in a category called alpha blockers. Those alpha blockers, those that are most common, one of them is called Flomax. It's the chemical structure is called tamsulosin. They have doxazosin, also marketed as Cardura. They have solifenacin. They have other type of alpha blockers that are produced, such as Cardura. And these are the typical, the three most common medications. And the way they work is they relax the prostate. By relaxing the prostate, it allows the urine to flow normally. This is how these medications work. So if you know of anybody who has problems with urination, frequent urination at night, you cannot sleep, you got to rush to get to the bathroom, it might be a time for you to see a doctor. One other test that is very important is after you urinate, it is possible to check the residual, meaning how much is left in the bladder. This is a portable ultrasound. The portable ultrasound has a probe, this round portion, and you put it in the abdomen like this. You put it in the abdomen. You press a button like I'm pressing this button here. There's a screen right there. And to the screen, you are able to read how much is in your bladder. So it's a portable device. It's a bladder ultrasound scan. It measures the residual amount of urine that is left in your bladder. Typically, we like to see less than 100 ml or 100 cc in the bladder after you urinate. If after you urinate, there's like 400 or 450 or 300 cc's in your bladder, that's way too much. You should be able to empty your bladder after you urinate. If you do not empty your bladder after you urinate, you are at risk of what is called urinary retention. The other thing that can happen is that your bladder can be so full it doesn't empty, that actually urine comes out of the bladder. It is called overflow urinary incontinence, as if you have a cup that is so full, the cup is so full that it's just like pouring water all the time. So the patient is incontinent, but the reason they are incontinent is because the bladder is too full, and therefore the bladder is overflowing. So it's important to evaluate that. And the bladder ultrasound is very useful because it allows us to differentiate patients who don't empty their bladder, and that could be a big problem. As I stated before, the same prostate can cause other problems, and one of the problems that can develop from the prostate is prostate cancer. And there's one test that is extremely useful in predicting who is likely to develop prostate cancer. Now, it's very important for you to realize it's not necessarily the size of the prostate. It's possible to have a very large prostate, but it doesn't necessarily mean the larger the prostate, the more likely it is you will develop prostate cancer. There's a blood test that can be done in the office, something like that. This is not real blood. This is just like a jelly, just to demonstrate that you can draw blood from a patient. You draw the blood, and that blood can be sent to the lab. This is not real blood again, but it's just to demonstrate the blood can be sent to the lab, and then to check a blood test called the PSA. It stands for prostatic specific antigen, PSA. Typically, we like the PSA to be less than 4 nanograms per deciliter. So basically just remember the number 4 and you'll be okay. So if you're a man, you're older than 40 and certainly older than 45, then you definitely, should have, or I would recommend you have your PSA checked when you have all your labs checked at your yearly physical, whatever. Check your PSA and ask your doctor what is the level, or ask if your PSA level was normal. If your PSA level was not normal, then it's elevated. That might prompt the doctor to look into it further, and typically a urologist at that point will need to get involved in order to perhaps recommend what is called a prostate biopsy, which I'll touch into a prostate biopsy, and I'll touch into prostate cancer, because it's such a common disorder, such a common disease. I think it deserves to be mentioned during this presentation. So we'll be back with more information. Again, my name is Dr. Angelo Gousse. I'm a board-certified urologist, professor of urology, practicing in South Florida, and this is a health show just for your information. See you later. Hello, welcome back to Gousse Urology Health Show. It's a pleasure to have you again today on our health show, where I will always be talking about something that is useful to your health, that if you don't have this disorder, maybe a friend or relative or someone you know, or the information might be very informative to you. My name is Dr. Angelo Gousse. I am a board-certified urologist, professor of urology, and I'm here practicing in South Florida, and I'm giving information about prostate disorders. And I already talked about benign prostatic enlargement, benign prostatic hyperplasia. This is a very common condition. It's almost a normal part of aging. Most men after the age of 40, they will have enlargement of the prostate. And that's a problem. And that can be very debilitating in some men. And unfortunately, sometimes the medications which fall into the category of alpha blockers don't work. There is another medication called finasteride, which it falls in the category of what they call 5-alpha reductase inhibitors. And these type of medications, they tend to kind of try to shrink the prostate. It takes a while, months, if not years, to really have a significant effect. These medications might have some side effects as well. I know some people know about saw palmetto. It works for some people, but it's not conventional medicine. It's not FDA approved, Food and Drug Administration approved to treat benign prostatic hyperplasia. So I was talking about the blood tests. This is not real blood, but I just wanted to tell you it's a regular blood test that you can get in your doctor's office, in your healthcare provider office, and that blood test will allow us to measure the prostatic specific antigen. And if your prostatic specific antigen is elevated, meaning it is more than 4, it might suggest that there could be prostate cancer. And one of the ways to know for sure you have prostate cancer is to undergo what is called a prostate biopsy. And in the prostate biopsy, a transrectal ultrasound probe is placed from the rectum, and then we can see the prostate, we can visualize the prostate, and with a tiny needle, it's possible to obtain some specimens, and these specimens are then analyzed in the laboratory, and we're able to see, you know, what type of prostate cancer, how aggressive the prostate cancer is, how much prostate cancer you have, and we are able, with the values of the PSA, we're able to determine in what category, if you do have prostate cancer, in what category you fall. Do you fall into a low-risk prostate cancer? Do you fall into an intermediate-risk prostate cancer? Or if you fall into a high-risk prostate cancer? So the high-risk patients are always at a higher risk, as the name implies, that they might have what is called recurrence of the prostate cancer. So the fact you had undergone treatment for the prostate cancer does not necessarily mean that you are completely cured. It is possible after treatment for prostate cancer to develop what is called recurrence, and often the recurrence is detected by a rise in PSA. You have another rise in PSA after treatment of the prostate cancer, then you are considered a recurrent patient, and maybe you need more type of treatment, sometimes more radiation, sometimes more chemotherapy, sometimes more hormonal treatment. So the treatment of prostate cancer can involve several possibilities depending on exactly where the prostate cancer is. Now, if the prostate cancer is only in the prostate, it is considered to be localized prostate cancer. It's only in the prostate cancer. It's not outside of the body. It's not in the bones. It's not in the glands, the lymph glands around the prostate. Then you have what is called a localized disease. The most common treatments for localized prostate cancer is either surgery, nowadays often done through the robot, called the robotic prostatectomy, where through a robot it is possible to remove the prostate entirely and reconnect the bladder to the urethral tube and remove the prostate. This is called a radical prostatectomy, when you completely remove the prostate. Important to differentiate that with what is called a transurethral resection of the prostate. When you have a transurethral resection of the prostate, you do not remove the entire prostate. You remove the lining, the meat of the prostate. You increase the channel, and therefore the urine is able to come out. So there's a big difference. So if you had a TURP, T-U-R-P, a transurethral resection of the prostate, you still have your prostate, and therefore you are still at risk of developing prostate cancer after a TURP, because they'd only remove the core of the prostate and the lining of the prostate is still there, which can develop cancer. So it's very important for you to understand that. When you have a radical prostatectomy, and a doctor is only allowed to remove your entire prostate if you develop cancer of the prostate. Generally, a doctor, a urologist, is not allowed to remove your prostate until you have cancer. If you do not have cancer, the prostate is causing problems. They can shave the prostate, they can trim the prostate, but they will not remove it. So whenever you hear someone, they actually remove their entire prostate, is because they had cancer. So that's one option. The other option is radiation treatment. You can do radiation, where external beam rays are sent to the prostate, and often you have to go there for about 45 sessions. They give it a low dose every time, so you have to have multiple visits to the radiation doctor, called radiation oncologist, to have your prostate radiated. And it's a very acceptable treatment for localized prostate cancer, along with removal of prostate, which is called radical prostatectomy for prostate cancer. So there are other treatments. Sometimes they can freeze the prostate. It's called cryotherapy. It is done, but nowadays I would say it has fallen out of disfavor in most cases. It's not a modality that I recommend often, if at all, to any of my patients who have prostate cancer. There is a modality called HIFU, high intensity focus therapy of the prostate. That HIFU, it's considered still in the early stages, in my opinion, and only might be useful for very, very early prostate cancer that is not very aggressive, and it's not a treatment, HIFU, H-I-F-U, that I often recommend, or if any time recommend to my patient. When my patients have cancer of the prostate, which is still localized to the prostate, I usually recommend to remove it completely or to have radiation. Of course, one of the concerns with treatment for prostate cancer remain the aftermath of that particular treatment. What can result after you undergo treatment for prostate cancer? This is a big area of concern for many patients. And this some patients avoids having their PSA tested, avoid biopsy, because they really don't want to know. They really don't want to find out they have prostate cancer, because they don't want to be faced with the decision of having treatment for the prostate cancer, because they know the potential side effects for the prostate cancer. And one of the most common side effects for treatment of prostate cancer is erection problem, sexual difficulties that can result from the treatment, particularly if they remove the prostate. Now, I want you to know, a lot of people believe that only prostatectomy can cause erection problem after prostate cancer treatment. This is not true. Radiation treatment to the prostate can and often will cause erectile dysfunction, will cause sexual difficulties as well. Urinary symptoms can be caused by surgery, can cause what is called stress urinary incontinence, meaning involuntary leakage of urine, which can happen. And some of these patients, sometimes they have to wear a penile clamp, and one day we'll talk about this in greater detail, but this is a possibility. This is a potential side effect of removal of the prostate. Similarly, radiation treatment can also cause urinary symptoms. Not only it can cause incontinence, but often it will cause burning during urination. It can cause frequent urination. It can make your urinary symptoms worse after you have radiation. In addition, one of the potential side effects of radiation is sometimes you have rectal problems with bowel movement control, or burning during bowel movements, or even some blood in the stool after radiation. Even years later, some patients have a little blood in the urine. All these things can happen as side effects of the radiation. But we talk about all these side effects, but one of the most feared side effects is the erectile dysfunction, the difficulty with erection. But I tell patients that it is possible to treat the erection problem. There are medications which might work in some cases that are mild. In addition, you can do penile injections where you can inject the penis. We've talked about it in our Gousse Urology shows already about this type of possibility. And also you can have a penile implant placed after removal of the prostate, and that you can salvage your sexual function. So remember, try not to worry too much about the side effects, because if you have significant prostate cancer and you do not treat it, then you put yourself at risk for advanced disease, for disease that's spread in your body called metastatic disease, and this is an incurable condition. So take care of yourself. If you think you have concerns about your prostate, go see a healthcare professional, go see your physician. Maybe they'll refer you, or go see a urologist, and they will evaluate you and tell you what is the best way to evaluate and to manage your prostate problem. My name is Dr. Angelo Gousse. I am a board-certified urologist, fellowship-trained urologist, professor of urology, practicing for many years in South Florida. It's been a pleasure to be with you in the Gousse Urology Show. See you later.